Hi, I'm Dr. Richard Usatine, recording a webcast for the International Dermoscopy Society, and this webcast was brought to you by Antelios. The topic for the webcast is basic dermoscopy cases, and I'm a professor of dermatology and cutaneous surgery at the University of Texas Health in San Antonio. Our first case is a patient with this on the skin. And when we look at it with dermoscopy, we see lacunae and septae, and that is the pattern of an angioma. Here's this dark lesion on the skin, and let's see what dermoscopy shows us. We still see lacunae and septae, another angioma. Angioma color may vary with skin type, but also varies within skin type. The pattern is the same, lacunae and septae. This firm nodule is on the lower leg of a woman. We see the clinical images and dermoscopy. In the dermoscopy, we see a fine reticular network, and we see this central scar appearance. If we pinch it and palpate it, it's firm and it umbilicates, or it dimples. That, of course, is a dermatofibroma. Looking at some more examples, here's a dermatofibroma on the thigh with this fine reticular network and the central scarring, sometimes with white lines. And these are the patterns. The peripheral fine network, also called delicate reticulation, and central white or pink scar-like area, ring-like globules and dotted vessels. Let's take a look at some of the ring-like globules. Here they are here, with the network around the edge and the central scar. Here's another dermatofibroma on darker skin. Very easy to see ring-like globules and central scar, reticular network. Here it is close up. Some of that white, those white lines that we see here, they often can be distributed like a starburst. Here's a better example of this starburst type scar. And here we see some of these ring-like globules and the network. Moving on to seborrheic keratoses, when we see these, we might see milia-like cysts, which really shine when we use our non-polarized mode. And then we have cometa-like openings, like this, and well-demarcated borders with fissures and ridges, all seborrheic keratoses. And then the flattest seborrheic keratoses, being formed maybe from a solar lentigo, can have fingerprints with moth-eaten borders. Now, what do we see here? Of course, it doesn't look good. It looks chaotic. Let's look at the dermoscopy close up. This is a basal cell carcinoma, and got some nice vessels here, which are branching, arborized like a tree. And then we've got this buckshot scatter. And basically we're looking, well, some white structures, and we're looking at a basal cell carcinoma. Here on darker skin, we see the clinical, dermoscopic, and dermoscopic blown up. We're going to see these ovoid nests and white shiny lines, arborizing vessels, put that together. And what do we have? We've got a basal cell carcinoma. Another example, the vessels can be fine. They don't have to be thick vessels, but they often branch or look like a tree. So we talk about arborizing. We got leaves on the outside, maybe a concentric structure here. It's all the same thing. These are the tumor islands with some pigment. This is a superficial BCC. Another superficial BCC with leaf-like structures and shiny white lines. Here's a really nice looking leaf, almost really like a spoke wheel. And of course, it's the same structure. They can be described as well. We can talk about them looking like leaves or spoke wheels. Now this patient comes in with this ugly duckling here, and we look at it clinically, dermoscopically, and with this we're going to see these shiny white lines and some abnormal vessels and this abnormal network. And with all this chaos, we are suspecting a melanoma, which in fact is what we see. We could also describe that as streaks on the edge there and some peppering over here. Superficial spreading melanoma. Look at this one, very obvious atypical off-centered blotch and some good negative network. Not good for the patient, but good for our eye and our diagnosis. And we've got another melanoma. And here we've got some possible blue-white veil if it's over a raised area. We've got abnormal atypical network. And so, again, we're looking at a melanoma. And here we got lots of streaking, pseudopods. We could call these pseudopods. But whatever we want to call it, this is radial growth, big, dark, atypical blotch, another melanoma, and some more blue-white veil, and some streaking here, some pseudopods, streaks, radial growth, melanoma. Here's this lesion on the back of this 29-year-old Hispanic woman, noted right after pregnancy, and got this pink area here, very, very pink. Most of the vasculature, and as we look at it up more closely with our dermatoscope, we not only see this pink area here, but we see white lines. We see serpentine vessels here. Let's look at that blown up. There's a serpentine vessel. There's the serpent. Okay. And all together, this was a melanoma, mostly a melanotic. Here's another example of a melanoma with negative network and an off-centered blotch. Another melanoma, streaks, and another melanoma. And this time, instead of streaks, we're seeing atypical globules, also representing radial growth. Here's some streaks. So we've got another melanoma, very chaotic. And then a bonus for us with our dermatoscopes is that we can diagnose scabies better than ever before, because you can see the burrow with the front triangle and the oval bodies. Here's the clinical, but dermoscopically we get so much more information. And the reason we get the triangle is from the head and the four front legs. And if you have a dermatoscope with ultraviolet light, you can actually see the burrows light up and the mites light up. Here's the mite at the end of that burrow, and another mite here with a triangle, but look how brightly it lights up green with ultraviolet, as well as the burrow lighting up with more of a purple look. And that is the end of our presentation. Thank you for your attention. And this was coordinated by the IDS, brought to you by Antelios. Thank you for your attention.